Welcome to The Explainer. Today, we're getting hands-on with a topic you might have experienced but never fully understood: manual therapy. You know the feeling, right? You're on the table and a physical therapist or chiropractor is pushing, pulling, or adjusting you. And you just have to wonder, what's actually happening in there? Are they cracking a bone back into place? Is it all about the muscles? Or is it something way more complex? Well, that is the exact question we're going to unpack today. All right, so first things first. Before we get into the weeds, let's just establish a really clear foundation. What even is manual therapy? Well, if you look at the official definition from the American Physical Therapy Association, it's a clinical approach that uses skilled, hands-on techniques. Now, the key words there are skilled and hands-on. But what's really interesting is that it's used to both diagnose and treat. So a therapist is using their hands not just to fix a problem, but to figure out what the problem is in the first place. And, it's not just about getting that satisfying pop or crack. The goals here are actually pretty specific and, honestly, life-changing for a lot of people. We're talking about modulating pain, increasing how far you can move, calming down inflammation, all the way to just helping you relax and ultimately improving how you function in your day-to-day life. It's a really comprehensive approach. Okay, so what does manual therapy actually look like when you're in the clinic? Well, it turns out it's not just one thing. It's a whole world of different techniques. You can think of it like a therapist's toolbox. Inside they've got massage, myofascial release, mobilization, manipulation, a whole bunch of specialized tools. And each one is designed for a very specific job, but they all fall under this big umbrella of manual therapy. Now, two of the biggest tools in that box are mobilization and manipulation. And it's super important to know they are not the same thing. Mobilization is more like a gentle push. It's slower, it's done within the joint's normal range of motion. Manipulation, on the other hand, that's the quick, forceful thrust, what's called a high-velocity, low-amplitude move that often gives you that pop. It's a more aggressive technique, often called a grade 5 mobilization. And this is where our story gets really, really interesting, because these techniques have been around for a long time, and they often get great results. But the original explanations for why they work, well, that's created a bit of a paradox. See, the founding figures of manual therapy, we're talking about pioneers, guys like Maitland and Coltonborn. They were absolutely brilliant clinicians. They developed these really complex models based on what they felt and saw, all to explain what was happening under their hands and to teach their methods to the next generation. But here's the thing. They built these models decades before we had the modern research tools to actually test them, which leads to a massive question. Were their explanations actually right? And here's the plot twist. When scientists finally put these old ideas to the test, a lot of them, well, they didn't really hold up. Some of the classic biomechanical rules turned out to have a ton of exceptions. The idea that a therapist could precisely feel a specific tissue proved to be pretty unreliable. And even the amount of force that therapists used turned out to be all over the place. So does that mean manual therapy is a sham? No, not at all. And this quote explains the paradox perfectly. It's like having a drug that works, but finding out later that it wasn't the chemical you thought it was, but maybe just the fluid it was mixed in that caused the effect. The treatment can be totally effective, even if our original explanation for why it worked was wrong. The effect is real. Our understanding of the cause just had to evolve. Okay, so let's shift gears from the theory to the actual practice. Because when you're applying these very real forces to a human body, precision and safety become absolutely everything. Think about it like this. Say you're describing your workout. If you just tell your friend you did a bench press, that's not nearly enough information for them to copy it, right? Was it a flat bench or an incline? Did you use a barbell or dumbbells? Were the reps fast or slow? The exact same thing is true for manual therapy. To be safe and repeatable, the technique has to be documented with incredible precision. So to get that precision, modern practice breaks every technique down into these clear phases. First, what was the patient's starting position? Second, was there a preload to take up the slack in the tissue? Third, what was the nature of the thrust itself? Was it fast? Was it slow? And fourth, how did the movement end? Documenting these steps is what makes the treatment consistent and, most importantly, safe. And speaking of safety, we absolutely have to talk about the neck, because this is the one area where manual therapy carries the most significant risks, and it's something every single patient and practitioner has to be keenly aware of. So here's the deal. The arteries that supply blood to your brain, the carotid and vertebral arteries, run right through your neck. Forceful rotational manipulation, especially of the upper neck, carries a risk. It's a rare risk, but it's a serious one, damaging these arteries, which in the worst cases could lead to a stroke. Because of this, the whole field is shifted. Gentle mobilization is now the preferred approach, because research shows it can be just as effective as a forceful manipulation, but with a much, much lower risk profile. And all of this brings us to our final and maybe most exciting section. We're going to look at how our whole way of thinking about manual therapy is evolving, moving away from simple mechanics and toward the brain. A perfect example of this new thinking is a technique called a mobilization with movement, or MWM. Now here's how it works. The therapist provides a gentle, guiding force on your joint while you actively perform the movement that used to be painful. It's a true partnership, where your own movement is just as important as the therapist's hands-on skill.
So, what's so cool about this? Well, look at the shift in thinking. The old theory was purely mechanical, that we're physically correcting a joint that's out of place. But research hasn't really backed that up. The new theory is almost entirely neurological. The technique seems to work by retraining your brain and literally decoupling that learned link between a certain movement and your experience of pain. It's like a software update, not a hardware fix.
So, if you take one big idea away from this whole explainer, let it be this. Manual therapy is changing. We're moving away from a purely structural model of just fixing misaligned parts, and we're moving toward a neurophysiological model, one that's all about changing how the brain perceives and controls movement. The therapist is less like a mechanic for your body and more like a systems administrator for your nervous system. Which really just leaves us with one final fascinating thought. This whole field started with brilliant clinicians making observations. Then science came in and challenged their explanations, which led to safer practices and a brand new understanding centered on the brain and the nervous system. If our understanding has already changed this much, just imagine what incredible discoveries about healing and the human body are waiting for us right around the corner.